Dr. Stephen Murphy of the Metropolitan Baptist Tabernacle Music Group.
Let us bow before the Lord. Dear God, we say thank you for your grace and your mercy that you allowed us to see another day. We pray and ask for your presence to be among us in this morning. We pray that you will bless every panelist. We pray bless every physician, every person who is taking the time out to share with our community the importance of cancer screening. We pray, God, for those who have suffered because of this disease. And we ask for your healing blessings upon them. And we ask that you will bless the memories of those who have passed on due to this. So God, continue to help us and empower us to bring awareness to our community about this disease. And we pray, God, that you will continue to empower us and empower physicians everywhere to look for a cure. We ask for your presence and your power to be with us. In Jesus' name, amen.
So I was thinking about how to begin this conversation this morning. And I always like to begin by confession. So my confession is my doctorate's in history. And I think of things in their historical moment. And I was in thinking about the conversation we were going to have today, it reminded me of December the 17th, 1903. I know you're going to say, what happened on December the 17th, 1903? It was the first flight of the Wright brothers. The Wright brothers flew for the first time in human history for 59 seconds. You said 59 seconds. We now fly for 15 hours. The first step was to be able to fly for 59 seconds. Here's what I want you to do, think about, record, talk about, get on your social media, whatever. It's January 31st, 2006. Because we are about to enter the future. This is the moment in Flint where you go into the 21st century in a way in which you did not imagine before. All powered by you. You are going to drive this future and this change. We're here to help. The group of friends, we'll talk about the friends as we go along. But I promise you, this is your future. I promise you that when your children, grandchildren in 2050 look back, they will understand January 31st, 2006 as the moment. This is your moment. So before we describe that reality to you, I want to ask some friends, because you have to understand who we are. I'm Gary Puckrin. I'm president of the National Minority Equality Forum. I told you my doctorate in history. I did that because I am no medical doctor. I want you to understand that, because that's not my job. Everybody in this process has a job. They need to execute it. I play a lot of football. You know, the coaches tell us, do your job. Don't worry about the next guy. Do your job. And there are a lot of folks here who have made this moment possible. So I want to start off by asking Mayor Neely to come up. He's been a deep friend. And bring some welcome. Mayor Neely.
I love Earth, Wind, and Fire. That's my theme. Welcome everybody. Good morning. It's another great day God has made for great announcements. And this place really feels great to me. The air feels thinner, feels blessed. Because we're all blessed here today by the presence of this program coming here. This is my old elementary school, now the Flint Development Center. I remember being an athlete here, breaking the scoring record right here in this gym. I never scored one basket during my elementary basketball career. That's a record. But definitely, I grew up 2 blocks away from this current location where we are now. I still own my family home. Many friends and family around this geographic area. It's very important for us to be engaged in this process. Those of us in this room will have a responsibility after they leave here to take the message back, to help educate, edify, and to be able to bring people to a healing. I lost my beautiful mother a couple years ago to cancer. She was a true champion that battled that breast cancer before it took over her body. She made her transition, but she left me with the earthly power to make sure we can empower people. And that's what your job is going to be here today to do, to get this great information, to bless somebody with it, to take it back, to be strong. And definitely we will welcome you, and we want to make sure that we have our partners. In the city of Flint, I say prayer, planning, and partnership. We pray, we plan, and we bring in our partners. Around this room, you see all of our partners to help increase the quality of life for every resident in this community. Healthcare. Health is a part of quality of life. Sometimes we take it for granted until we fall sick, or a person that we love falls sick. This is being proactive and engaged. Thank you, Dr. Pucker, for doing this. Thank you for being here. And thank all of you. Make sure you are engaged. God bless.
I'm now going to ask Commissioner, County Commissioner Aretha Lloyd to come to greetings.
God bless all of you. Good to be here today. You all look absolutely amazing. There's one theologian who would normally take the stand in any place, and he would begin by stating the obvious, which is days are not for sale, nor can hours be bought, but every day we get is a gift that only God can give. And that's one of the reasons why we're here today, because there's a gift that has come to our community through the National Quality Forum and the work that they are doing and the science that is available, not just to preserve the lives of individuals who may have cancer and may not know it, but it's also a gift that keeps giving because it also helps to preserve family dynamics as well. So many across our community, even as a pastor myself, so many times I've received the call to go to the hospital, to be at the bedside of one who is at the end of life. And normally, when we go to the bedside of those individuals, who many of which have found out that they have had cancer, and it's been in the fourth quarter, it's been in the term of their recent diagnosis. And rarely ever, really never, do you hear them talk about the color of their skin or their social economic background. Never do I hear them talk about their political association or their associations to various organizations. But what I do hear them talk about is legacy. I hear them talk about their family. I hear them talk about, if I just had a few more days, a few more hours, I would have cuddled my family more. I would have spent more time with my loved ones. And I could go on and on and on. And that is just the illustrative picture of how important this moment and this science truly is. That there are less families, if tested or detected early, will have to have that conversation at the bedside with their priest or their pastor or their rabbi. There'll be less families, the more that we have tested, that will have to grapple with the sudden loss of a loved one without time to say, I love you, or to spend more time together. And so I'm here on behalf of Genesee County, along with the city of Flint and Mayor Neely and other partners and advocates that are here just to encourage you to get involved, to study the information, to pass the information on, to share it with other people. Just the other day, I had the privilege, I had the honor to be the first person to sign up to participate in this study and to be the first person to have my blood drawn and to be tested. And I tell you, when I looked at all that blood they drawn, I was looking for a granola bar or a cup of orange juice or something. But anyway, I joke with you because the process was very simple. It was very easy. It was truly painless, but it was something that I know will not just potentially save my life, but save your lives as well. So again, on behalf of the Genesee County Board of Commissioners, I give you greetings. There's 2 proclamations that are here, and I'll get them into your hands that have been signed by all members of the Genesee County Board of Commissioners. One of those proclamations is for the individual who presented this to us well over a year, maybe 2 years ago, in the person of community advocate Arthur Woodson. Will you stand, Arthur Woodson, and wave your hand? It was because of his cause. It was because of his persistence. It was because of his public speaking before the County Board of Commissioners that we joined together in a bipartisan way, not just to support all partners in this effort, City of Flint, all partners in this effort, but also to contribute without discussion $100,000 toward these tests taking place within our community. And so we have a proclamation to recognize your advocacy and you're presenting this information to us. I'm here because you came to us and want us to be a part. And then lastly, we have a proclamation as well for you, Dr. P, and your team. I know that you will introduce them. Thank you for seeing it in your heart and taking the time to come to our community. Many of us didn't know you, you did not know us, but yet you cared. And so we just want to say thank you. Can you stand and just clap your hands? And let's just say thank you to his team, to Dr. P, to all the partners, community activists, for all the work that you do. Welcome to the 1st District of Genesee County, which I represent. Thank you.
Thank you so much. You have a little video, please. You want to run the video? Can we turn down the lights? Is that possible?
Great growing up. You know, we had our struggles, unlike any other urban community. But growing up, it was, you know, I never imagined that my children would, you know, I always wanted children. I just never imagined that they wouldn't be in Flint, working in Flint, prospering in Flint, because we see prosperity around everywhere we turn when I was growing up. So this is what my normal was.
Flint is a community with history, built on work, family, and pride. And for many residents, the story isn't just what happened, it's what they've lived with ever since. On April 25th, 2014, Flint switched its water source to the Flint River. Without proper corrosion control, residents faced an increased risk of lead leaching from aging pipes.
I didn't really recognize them until I got into the schools, because you see the hair, the bald patches in children's hairs, and you see that families are really struggling to pay these astronomical water for water we still can't use. So for those who are saying the water is safe, that's not true. Absolutely not true.
Flint residents had long raised concerns about contaminants associated with the water crisis: lead, PFAS, and total trihalomethanes, TTHMS. Michigan Department of Health and Human Services says more research is needed to confirm causality of cancer. When a community is told to believe one thing and experiences something else, trust doesn't just crack, it collapses.
We have trust issues in Flint, not just in the community that I'm speaking of, but myself also, because we've been told so many false narratives.
And over time, that broken trust turned into a bigger question: what does this mean for long-term health? In 2021, the Michigan Department of Health and Human Services released a cancer incidence review, looking at Flint from 2000 to 2018, compared to Genesee County and the state. By 2022, public reporting amplified what many Flint families had already been saying. Concerns about cancer were rising.
It's going to take time, but unfortunately with that time, it'll come some trial and error. Is it more cancer cases? Is it more deaths? We don't know, because it's a high price to pay, right? It's not worth the risk. People don't want to gamble with their lives in it.
That's why this work matters now, because in communities like Flint, waiting is not a plan, and late detection is not acceptable. In the National Minority Quality Forum's own survey work, residents in and around Flint identified cancer as their top health concern, a direct call to action, not just observation. Early detection is one of the strongest tools we have, but too often underserved communities are diagnosed later because access is delayed, follow-up is slow, and care is harder to reach. That delay costs lives. The National Minority Quality Forum is working in Flint to shift the timeline earlier toward cancer detection before symptoms and toward care systems that respond faster when risk is high. That mission has a name, the Cancer Stage Shifting Initiative. CSSI exists to reduce cancer disparities by shifting detection earlier before cancer becomes advanced and harder to treat. Part of that work is showing up now, bringing screening, education, and trusted health resources directly into the community so access doesn't depend on luck, time off work, or perfect transportation. This is also about the future of detection, multi-cancer early detection, tools designed to identify possible cancer signals from a blood draw, including cancers that don't have routine screening today. And for communities like Flint, the goal is not only earlier detection, it's changing how clinical care responds to environmental risk, earlier monitoring, faster evaluation, and fewer bottlenecks when time matters most.
Because Flint, once upon a time, was a great place, and my hope is it will be again one day.
Early detection is power, and prevention should be available everywhere, especially where risk has been ignored for too long. Today, we collectively say I'm in on life-saving research.
Thank you. One of the things that I'm going to say over and over again here is that NMQF is not doing this alone. It takes a community, it takes a village to drive change, to drive sustainable change. And I want to introduce you to some of the folks who are part of your army. Folks that you probably never heard of, don't know anything about, but they're here working in the background. When you go into that doctor's office, there's an army in that room with you. And we want to make sure that you at least know some of this. They need your advocacy, they need your support, but even more importantly, they need your energy. They need your energy. They need the same kind of energy that Arthur Woodson brought to this conversation and helped put us in this moment. So first, I'm going to be a little selfish and ask the NMQF staff to stand up so you begin to know who they are. They're going to be with you for the next 5 years. We ain't going home. We're going to be with you. So the NMQF staff, Christina, Jody, whoever you are, as you are, please stand up and let folks recognize you. They've already been here a couple of years. You may not know that, but they've been here working in the background. Thank you for that. I also want to introduce Bioassistant and the Carolina Bioecology Institute. Unfortunately, you guys got this weather thing going on. I come from DC, you don't do weather. I've been driving around and you don't even plow. I'm like, man, we got to drop the snow, we go home. You guys don't even plow the building. Anyway, a really, really important person, Dr. Howard, is not with us because North Carolina, you all said something that don't want to slow down there in North Carolina and shut him down, so he's not here. He helped us write what is called a protocol for this study. None of us is in this room if he didn't help us do that. He is a world-class scientist, lives in North Carolina, doing incredible research, and Camilla from his staff is here. Camilla, will you wave your hand? They are going to work with your research center. I haven't told you yet that you got a research center that was just built in Flint for you. But her team, Dr. Powell, some other folks I want to introduce you to help to drive that. Because we have to do impeccable science. Impeccable science. Because you're going to have a lot of naysayers out there. You're going to have a lot of let's maintain the status quo folks out here. You're going to have a lot of people who don't give a doggone, right? But we are going to use science to help save lives. And there's a whole team that's coming together to help you do that. The other part of your team that you may not know are the innovators. You have innovator companies who are helping to sponsor and support this work in Flint. These are world-class companies who are at the frontier of knowledge, changing the way we understand certainly cancer, but disease. So around the room, I'm going to ask them to stand up. Angie, Exact Science. I think Genentech, I know you don't have a table here, but please, Genentech, stand up. You need to know these people and thank you because they are working hard to save your life. I'm going to ask you to do me one favor. This is really important. I know you want to go to them and ask them about their science, and please do that. But tell them your family story. Tell them your story about cancer, how it has shortened lives in your family. Because guess what? They have to go home and help their colleagues understand that there's something very unique and different and perhaps even ugly going on here in Flint that needs the science and technology that they are creating. So task one, tell them your story. And I know you guys are on Facebook. Go on Facebook. Go on LinkedIn, TikTok, wherever you got. Tell them the story about how cancer has infected your life. And so why am I saying that? I'm saying that to you because if you pick up clinical guidelines, you may not know it. It's like a recipe book that doctors use to treat diseases. If you go into that recipe book, there is no recipe for treating patients who have been exposed to environmental toxins. There's no recipe for that. We have to go write that recipe. We have to train them. It's part of what you are about to do. That's why I'm saying we need your energy. We need you to speak up. So during the course of the day, I'm going to ask you, if you don't mind, we'll go around the table, tell your story, tell your LinkedIn account, your Facebook account, whatever account, because it's all going to be about social change. I also want to thank all of the other sponsors. Some of them are not here. Again, it takes an army. Hurley Hospital, Radiant, over there. These are folks who actually provide the care. They're important to you as well. And so by you telling your story, you are going to help us all be better advocates for it. Because one of the things you have to appreciate, if you ain't advocating, you ain't getting. Advocacy is a branch of medicine. If you ain't advocating, you ain't getting. I'm just telling you. I live in Washington. All we do is politics. And if you all ain't coming up here complaining, we don't even know you exist. I'm just being frank. Okay? So that's your army. People in labs. Probably some of them global, never even heard the word Flint. And so by you going online and telling your story is incredibly, incredibly important. And I want you to take that assignment and see what you can do about There's also some local folks here who have helped to drive change. And I want to step aside and ask Mayor Neely to come up with some proclamations and things of recognition that NWF has asked Mayor Neely to do on our behalf and on the city's behalf. Mayor Neely.
Thank you for that. Thank you for that. And thank all of you guys for your patience and understanding as we get ready to do this important work, this important business that we have. But definitely, we have our partners. And everybody has a level of value as we look at doing positive things. But every positive, fruitful life is fueled by certain things. Positive and fruitful lives are fueled by love, compassion, generosity, and caring for one another. That is a positive and productive life. And we all need to be able to share with one another. Because we know that when we lose someone, sometimes that's a deficit that you can never overcome. Financial deficits you can overcome. Death deficits you cannot. So embrace everybody, embrace those things and those positive fuels that we have in life to be able to have that level of productivity, love, generosity, charity, caring, and giving. So I have the duty and responsibility to present these and thank you, Dr. Bruckman and your team. I think we have 3 people. First is a student for the student category. We have the student category, the patient category, and also the community category. And I know we have an optometry truck outside. If anybody can go out there and give me the size 2 readers, would be really good. I need those prosthetics sometime. But definitely we want to recognize Asia Donald. Is she here? Did she make it? Asia Donald? Come on here, Asia. Thank you for saluting this young student. And the future belongs to these young people. So we have to pour into our young people, invest into our young people. If not, we become weaker as a nation. Asia, on behalf of the residents of the city of Flint and the forum, the day is honored. And that's actually those advocates and those concierges wanting to help you navigate the healthcare. We have had a strong individual in this community out here every day, true Flintstone, engaging in this space. Nurse T, we salute you. Is Nurse T here? Come on up. I heard that in the out there. She used to be running that state representative Cynthia Neely back in the day when she first arrived to this community. But definitely looked like doing productive things. And Nurse T, thank you for all the great work that you've done. It has not gone unnoticed, especially by your community and the residents that you serve. You have been doing a fantastic job, and you are blessed, and you are a blessing. We love you, and God is with you. And the community, and I want you all to get your cameras ready. This is going to be a photographic moment. This is going to be y'all know, right? But definitely, as growing up as Flintstones, we are really, truly all family. I talked about being a student here at Bunch Elementary School and graduating from Northern High School. I want you to give it up for that. All right. Also a young man who went there and played in these gyms. And I was a superstar athlete, right? And we all came together as family. We truly are family. And recognizing that we have bigger issues in our community, bigger giants to slay. And we have to do that with love, compassion, care, and generosity. We do that. In the name of our God, we do that. This next person we're going to bring up to the stage is Mr. Arthur Richardson. Now, we go back, we went to the same high school, we had many days. And back in the day, we used to call it panning. We used to be an art form, and we talked about each other. I was good, he was the best one. And he's a great guy. Thank you for your advocacy of this. He's at the state level advocating on this. He's been to my office, at the state office, talking about family members that suffer from cancer. He's been at the city level talking about this. And you've been a true champion, and your voice has been heard today. On behalf of the city of Flint.
Okay. So they wrote down on this piece of paper that I've been looking down at, and it says, so why are we in Flint? So I'm going to tell the story a little bit about why we're here in Flint. So, as I told you, part of my life, I was a historian. And one of the things I started to do was to collect health data. I published a magazine for Smithsonian, and it taught me about zip codes. So there are about 40,000 zip codes in the United States. 70% of African Americans live in 2,400 zip codes. 2,400 zip codes is where the African American population resides in the United States. And nobody was collecting that data at the zip code level. And I said, oh yeah, we need to do that. And I went about the business of collecting health data, not just for those 2,400 zip codes, but for the whole United States. We built a database of over 5 billion patient records. We collect data on about 160 million lives a year, covering well over 100,000 different conditions. So when Vice President Biden was launching the first cancer moonshot, he asked us to map cancer at the zip code level. He had the data, we did it. When he became president, he came back to us and asked us to be part of his cancer moonshot. And we started working on that cancer moonshot. We're looking at the data. And I don't know if you understood, the goal of the cancer moonshot was to reduce cancer mortality by 50% over the next 25 years. I thought 25 years was too long. I thought we should be looking at that. And I would go to these White House meetings and they would talk about cancer. And what I realized is that they didn't know cancer as it was impacting our community. There was nobody at the table. And at that time, Vice President Harris came to Flint, ran into Arthur Woodson. She promised to help identify what Arthur thought might be a cancer cluster in Flint. And he shows up back at the White House asking for the help that she promised. And she called up and asked us if we would help, and that's how we got to Flint. That's the story. So, in doing that, we started to take a deeper understanding. And we went back to the White House and said, we need to have a listening session. We need to bring folks from the community so that you understand, I'm talking to the White House now, how cancer presents in our community. Because the other thing that we learned along the way is that actually you're not alone. There's Cancer Alley in Louisiana, Black folk. There's the 5th Ward in Houston, Texas, cancer cluster, Black folk. All across the country. And it's not only Black folk. There are a lot of communities where people are exposed to environmental toxins and it elevates their risk for cancer. And guess what? We do a lot of publishing about it. You can go Google it, you can find lots of stuff, but ain't nobody showing up to help. Really? And so that's how we said, we can't look at these numbers and not do something about them. And at that moment, as we were thinking about it, is all of this new science that's breaking out. The way I can describe it to you, the easiest way I can describe it to you, is if you had a brand new car and didn't have a gas gauge. And so the only time you know it was running out of gas was when it shut down. That's called a symptom. My car just had a symptom. It ran out of gas and it stopped. That's how cancer is right now. We wait until you're symptomatic. And sometimes, like pancreatic cancer, it's too late. But the new science is saying we can look 5 years down the road and see cancer forming in the body before you're symptomatic. Think about that. So I'm saying to you, I'm sitting here in 2026, we could draw some blood, and I can tell you in 2031, you're going to be symptomatic for cancer. That's the future, baby. That's science and technology. That's the power of what we have. But what's even crazier, I'm going to ask Julia to raise her hand back there from Quest Diagnostics, because Quest has put that power into our hands to take into community. Because it ain't just cancer. Because you are exposed to environmental toxins, you also have an elevated risk of Alzheimer's. Well, guess what? There's a test for Alzheimer's disease that can look 10 years out and say in 10 years, you're going to have symptoms for Alzheimer's. Oh, and diabetes. About to do Parkinson's. Hear what I'm saying to you. That we are starting to look at your blood chemistry and change the way in which we think about and do medicine. That's disturbing to a whole lot of folks, for a whole lot of reasons. And over time, we'll have this conversation because people will want to know how we pay for that. How do we do that? And that's why your advocacy is going to be so incredibly important. We have to be relentless. Relentless. Your lives are on the line. The lives of your children are on the line. No joke. And we have the power now to make a difference. Not just in Flint, Cancer Alley in Louisiana, Flint Forward in Houston, Texas. We all come together, change the world. Change the world. So what we want to do here, part of our exercise, is that we want to enroll 200 people from Flint into our study. We're going to follow them every year for 5 years, and all those tests I just described to you, probably more on the way. They're like your astronauts. Remember, I started this telling you that the Wright brothers flew for 59 seconds. Well, we're in the 59 seconds part of the conversation. But we need your help. You have the power. You have to trust that we can get there together. We can do really great things together. Single-minded. purposeful. That's what we're about. And what we've also done here is we have put a research center in your community. I'm going to ask the folks from Life in 3D to stand up because they're your scientists. They are in community, and we put this research deliberately in the community. I'm sorry, Michigan State University or Michigan, blah, 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 blah. We want it here with our people, doing our thing, open up our future. That's your team leader. You need to go talk to them. They're going to be navigating this future for you. And here's the point, I want to stress it for you. I told you that when you go and look at clinical guidelines, the recipe for how do you treat diseases, you're not in the recipe book. These folks are going to collect the data so that we can write the recipe, not just for you, but for communities that look like you across the globe. You are now at the front line. You are the future. January 31st, 2026. Flint walked into the future. That's what we're doing. That's our purpose. We can help you, but it is your energy that's going to drive the change. It's your deal. We'll find every resource we can find for you. We are not going to bring anybody into the community that we don't trust, and you don't trust us, and you don't trust us. That's a promise. We've worked for years for this. Now is the time. So we have a video that I want to run because in order to do clinical studies, you have to do it with informed consent. The people who are in the study have to consent to it. And I want to walk you through what that is. And here's the reason why I'm saying this. Because we don't want anybody challenging anything that we do. And you know, you live in the same space I'm living in, and a whole lot of weird stuff going on out there. And we have to make sure that we're impeccable with our science. So if we can run that video, and I'm going to step aside and let go.
Hello, Flint, Michigan. My name is Dr. John Powderly. I'm an oncologist here in Charlotte, North Carolina, and the founder of Carolina Bio-Oncology Institute, which is a phase 1 research clinic, and also the founder of Biocytics Human Applications Lab, which is a research lab and CLIA lab that's involved in immunotherapy and detection of cancer. And we've been doing this a good 20 years. And I had the pleasure of meeting Gary Puckrin about 4 years ago when he came to a cancer symposium in Charlotte and told a large audience about the mission of the National Minority Quality Forum and the Cancer Stage Shifting Initiative. And it resonated with me because I understand labs, I understand the value of early detection, and every day I see metastatic cancer patients who have run out of options and are searching clinical trials. And I know how a really good designed study could have a huge impact on populations who need it most. So I really, really wish I could be there and meet many of you and celebrate the opening of the trial in Flint, Michigan. But as you may have heard on TV, tomorrow, Saturday morning, we're expecting about 3 a.m. to have a bomb cyclone of a near blizzard conditions with 30-mile-per-hour winds and 5 to 7 inches of snow, and I'm pretty sure the airport will be closed tomorrow. And Cammie, I know you're there. I hope you can make it back late Saturday, but it might be Sunday or Monday at this point. So I wanted to talk to you about my role in the study and more about the study and the why. And I know Gary has probably explained all about the health disparities, and he's an expert in that. And I admire so much his passion and his drive to carry it through the great need to open up these studies. My role is a little bit more on the technical back end of the regulatory and quality and making sure we're getting accurate data, that the database and the questions that we're going to be asking volunteers are important, and that we have measurable outcomes, and also that the samples we collect go to good use and they're ethically collected, and they're going to have good high quality data when we analyze the study over the next 5 to 10 years. So I understand that Flint, Michigan, I think is the second or third site open, which is fantastic. And these sites that are opening are community-based, which is where the patients are, and in communities where there's going to be lots of outreach, going out to churches and community events and anywhere to get the word out for healthy volunteers who may be at risk of cancer or who don't know what the risk is, but they can learn about what are the cancer risks and what are the proven methods right now to detect cancer early with mammograms and prostate exams and colonoscopies, which work good, but not good enough of where we think we can get better with laboratory research in the future. So my job is to make sure that we follow the best practices to make sure all the samples in the trial is rolled out in a well-coordinated way that would pass FDA scrutiny should those samples actually develop a laboratory assay that prove that the studies work and therefore the device works. And therefore we now have something we can roll out and rely upon to inform patients that yes, indeed, you have a clue or a signal that there is cancer. Now you need to go get more imaging or a biopsy or work it up more aggressively. So that's the background to the study. So I'll talk a little bit more about why the population of patients that we're approaching are going to be important. So to have a really good ethically designed study that is going to give us an accurate data set about determining answers as to whether or not we can detect cancer early, we have to have true negative patients, meaning volunteers who definitely don't have cancer. And then we have to have true positive patients, which we have a lot of those patients in our clinic, unfortunately, that are known to have metastatic cancer. In those two populations, we can get those samples relatively easy. But what is really valuable is the patients in the middle. And those are healthy patients who live in communities that may be at a higher risk, don't know the risk factors, may not get screening as frequently as they should, and therefore we want to capture those patients to offer them to enroll in a volunteer research study so we can help them get cancer screening, mammograms, colonoscopy, prostate exams, and make sure that they also have the opportunity and awareness of this trial so that if they choose, they can volunteer to give samples of their blood, which would go into a biobank, basically a liquid nitrogen tank where we can freeze it in a way that we can explore those samples with different types of laboratory technologies. And in modern laboratory medicine, we've come a long way over the past 20 years. We have the technology to detect cancer in very, very micro levels through many different types of assays. But the missing piece is doing a trial where we actually can see which of those modern technologies work the best for different types of cancers, what levels are needed, and then if a volunteer patient does turn out to have a trace positive, a signal that there might be cancer hiding, we want to be able to work that up and offer to help them get coordinated and navigated in to get additional imaging and workup. So that's the purpose of the study. So the main objectives is first to identify and reach out to collect the patients to get good, accurate health questionnaire histories and collect data about volunteer patients in Flint, Michigan. That's the first primary objective. Get lots of data. Understand the risk factors in your community. Second objective is offer to get the samples if patients are willing to donate. Even if they don't want to donate right away, that's okay. The study still allows them just to collect their health questionnaire data, and then they can change their mind and donate blood later. Is to collect a few tubes of blood that we can do good research on. Bank it for many lab partners who want to explore their highly sensitive assays, and then coordinate follow-up visits if some of those come up trace positive. So that's the second objective. The third objective of the study is to work with many, many different laboratory partners that make devices, assays, reagents, and technologies that they think in their labs, in their early studies, that they can detect cancer early. We call this multi-cancer early detections. And not just detecting one type of cancer like prostate with a PSA, but instead being able to test many, many, many different types of cancers, many of which we don't have good screening tests for at all. So this is a big promise and a big hope that might be possible, but we don't know for sure. So that is why the study that Gary and I designed is large enough with 100,000 patients and probably over 20 sites across the US in the underserved communities that need those types of research trials the most, so we can reach out and enroll those patients over the next 5 to 10 years. So, and we feel pretty confident with the many different laboratory partners and technologies that are out there that they will have good use and access to these precious samples that you would donate. So we can learn and figure that out and test that over time. It may mean that if you have a trace positive clue or signal that it might be cancer, you may have to come back or be invited back for additional visits. But that would be part of the study that will give us the answers that we need. Nobody in the study is going to be neglected. And everybody in the study has to understand that in an ethical research trial regulated by the federal government with all the ethical constraints is that it's completely voluntary and the patients have the total right to withdraw at any time. It's total withdrawal. We want patients to understand that it's completely voluntary and that therefore there's no pressure. You can think about it and you can decide later, come back in a couple of months or 6 months or whenever. The study's going to be open in Flint, Michigan for many years. And if you do enroll, there's no issue for you to withdraw your consent. You might be wondering, how is your data going to be used? How is your samples going to be used? Great questions. Because the database that NMQF is setting up, it will be de-identified from patients' address and names and phone numbers, from any types of extraneous lab companies or research companies that might be looking at data, at trends, or even looking at the samples that come from volunteer patients. So that personal health information is separated from your medical history, and those are separated from the genomic samples such that the blood samples, the genes would not be directly linked to you as a person with you as an address. When you look at those, that data set from the health questionnaires, from getting access to your hospital records if you provide permission to do that, to look at any diagnoses or other risk factors you might have, and linking that to the early detection tests in the labs we're working on, and with the genomic assays that our labs will be working on. That is one of the most powerful data sets that I truly believe has the potential in 5 to 10 years to really, really make an impact. And that's one of the measurable outcomes of this study is, can we actually detect cancer early? Can we do it better than mammograms and prostate exams and colonoscopies? Can we make an impact on your community there in Flint, Michigan? And I think with this trial and with this data set and all the ethical standards that we are going to enable and protect the preciousness of the sample, the dignity of each patient, the right to decline or withdraw your consent, we think that we can still answer all those good questions. So what we ask of the volunteer patients is to give the trial a good chance to learn about it, so you can ask questions. And then if you are interested, the NMQF team and the Flint, Michigan community-based site will be reaching out to you to give you an informed consent, which is the ethical process for us to document so that you understand about the study and we can then safeguard that understanding that you understand the samples are being volunteered, we're doing research on your tubes of blood, it might lead to discoveries, and it might, in the long run, may benefit the community. And so that's the main take-home points I want to get across to the community as they listen to this. And I want to thank very much everybody who's coming out there. Some of our team members, Tammy's there, she's doing due diligence on quality and regulatory monitoring and inspections of the documents to make sure things are going from a regulated FDA standpoint. And I know Gary and his team are leading the charge to get the word out and to initiate the site, and they're going to take it to the next outreach into the community. So I look forward to being involved behind the scenes and hopefully come to Flint, Michigan in another year and learn more about your community site. So thank you very, very much, and thanks for giving me this opportunity to help be an investigator in the trial in your community to detect cancer early. Thank you. Hello, Flint, Michigan. My name is Dr. Jim.
Thank you. I'm going to ask Dr. Tang and Anika Dolphin to come up. We're going to open up the mic and turn on the lights so you can ask questions, but I want to make sure that they're here. Maybe they'll say a few words before they go to Q&A. We've got some mics here. Sharon, if you have to pass the mics around. And if you've got questions to answer, first, let's let them introduce themselves.
Good afternoon, everyone. I am nurse practitioner Danica Dalton, and I have been tasked with the assignment by Arthur Woodson and the National Minority Quality Forum to be your clinical research facility. We are located at 2425 Austin's Parkway, right behind the Chick-fil-A off of Miller and Austin's Parkway. Quick reason why we're here. Let me ask you all a question. Raise your hand if you've ever known or know someone that has experienced any type of cancer. Raise your hand. All right. Look around the room. All right. So the next question is, stand up if you've lost someone to cancer. This is our why. Look around the room. I'm going to hand the mic over to Dr. Rocky.
That's powerful. My name is Rockefeller Otang. Everybody calls me Rocky because Rockefeller's a mouthful. My parents were real hopeful last time I made some money, but we're trying to help people instead, right? So I am an emergency physician. I work in the emergency department. I actually met, I think, 2 people here that had met me at the hospital. Luckily, it was positive. They didn't give me one upset. So I've been up here working at Hurley. That's where you'll see me, hopefully not in the emergency department, but I work at Hurley. And just trying to do the best we can when folks need us in the emergency department. My role in this, I actually do a lot of clinical research. I work for the University of Michigan, who actually staff the emergency department at Hurley. I do work in helping developing countries create emergency systems. I do work around traumatic brain injury. I am really interested in helping people help themselves, right? Oftentimes in the emergency department, when I see people, it's really sad for me because they don't know a lot about what's happening to them or with them. I'm sure the 2 folks that had seen me before would mention this, that I really want to talk to people when I see them in the emergency department. I want to make sure you understand what's happening and why I'm doing the things that I'm doing. I always want to make sure I understand what you're concerned about so I can make sure I've addressed it. So with this study, with this idea that we can do better for the people in our community, we want to make sure that we are using the best available technology to help people make decisions about what they want to do with themselves, right? You can't address a problem that you've not seen. You can't address a problem you have no idea about, right? Cancer took my mom a few years ago, and It's still something I work through each and every day. So it is something that is personal to all of us. And if we can do better with it, find it earlier, give us a chance to do better about it, why not? So we're available. We are at the facility here in Life in 3D, as she said. Danica here is my sister. Just to be fair, everybody knows she's like a sister to me. But we are going to do the best that we can to make sure that the folks who volunteer to be in this study are taken care of. In the sense of, say for example, a sample comes up, you give your blood, and one of the signals comes up positive saying maybe there's some cancer there. We will help you to get into a doctor's office if you don't have a doctor, number one. Act early, we have a free clinic, we have a clinic that will see any patient whenever they need to be seen. Insurance, no insurance, not a question. The second part, if it ends up being cancer, because we've done the testing that needs to be done after the initial blood testing, the Cancer Institute, who we work with at Hurley, have spoken to them, been on the phone with them, had a good conversation with them. They are super excited about this technology because for them, their job is cancer and curing cancer. If they can find it earlier, it gives them a better chance to help out. They are also on board. They are ready to see and take care of the patients if they have cancer and are diagnosed with it. So if you are part of the study and a signal comes up, we've got a pathway for you to help you see that through the whole process.
So, on their desk here, and later on when we go into the meeting clinic, you can come up and express an interest in the study so that they can do follow-up. So we ask you, if you're interested in the study, please, Sharon is showing you, if you've got a cell phone, you can click on it and it will take you to the place where you can note that you're interested in follow-up. And so we ask you to please join us. So I'm going to open it up now for questions. If anyone has any questions out there, and please do not be shy. There ain't no shy stuff. If you've got real questions or even phony questions, if you want to get answers, please don't stay.
Well, my question is, are you looking for any particular age groups or all age groups?
So the study is 35 plus. Yeah, so it's 35 plus in the study.
Did I hear you say that you're looking for healthy candidates? I think a lot of us in here probably got health issues.
No, we're not, but it's all comers. Even if you were diagnosed with cancer, you're welcome to come into the study.
I'm thinking of other diseases.
Doesn't matter.
Thank you.
Hello, thank you so much for this presentation. I have a couple of questions. First, about the screening tool. What is the name of the screening tool? And is there any information that we can get about the tool, like the sensitivity and specificity, if we already know that? My second question is about the methods. Does everyone involved get the screening, or is there like a control group? Is there groups that get business as usual, or is it everyone gets the screening? Thank you.
Good question so far. So everyone 35 years of age and older, non-pregnant, and no active viral load are able to participate in this study. The screening tool, it's not to test for specificity, it's simply to screen to see if you're a candidate to participate in the study. Did I answer your question? Sarah, that was for you.
My question is, where will the samples be held? Here in Flint,
No.
Maryland? I mean, where is our DNA gonna be?
So we have the biobank with Quest Diagnostic. Julie can probably tell you the exact location of it, but they're all stored together in the biobank that NMQF has control of. But again, I want to underscore, because implicit in your question, we don't know who you are.